screens. Hey, everybody, we're just going to let everybody get situated. If you're just signing on, we're excited to talk to you. Feel free to drop a line, tell us where you're coming from, location-wise, not like from a place of angst or happiness, but we'll be happy to, we'd love to see where everybody's writing in from. But Lisa, I was sort of explaining in yesterday's live stream, I liked the airplane analogy too, because for me, like, I'm comfortable in an airplane when there's really bad turbulence, but the minute I see the flight attendant sit down and start to freak out, that's
you're like, oh no.
I start to freak out. Yeah. And I feel like that's sort of like what's happening right now, is that like we're seeing everyone around us going, uh-oh, so we're going, uh-oh, you know.
Yeah, for sure.
Lots of airplane analogies. Hope everyone is doing well tonight. Please say hello. Let us know you're here. Let us know where you're joining us from. Feel free to comment. We will be answering questions very shortly. And we will get started in just another minute. So come inside, grab an hors d'oeuvre.
No double dipping.
No double dipping.
That's right.
No double dipping.
Especially not right now.
You can be sure there's no double dipping now because you can't even do it.
Dipping. That's right. Yeah. None. Yeah. None at all. Yeah. Hope everyone is doing well tonight. As I just said, say hello. Let us know you're here. Let us know where you're from. We always find that interesting. And we will start in 20 seconds to reward those that are on time.
Oh my goodness.
No pressure. This is the part where I pretend I'm busy for a moment. Like,
you're good at that.
Important things.
Hi, Jessica. She's from
Hi,
Massachusetts.
Jess is awesome. She's such a cool advocate and strong person. I'm a big fan of Jessica's. Hello, my friends. Hello, Adriana. All right.
Yay. Hello, Adriana.
Hi.
Hello from Hong Kong.
I'm Manila.
Greetings. I hope all is well in Hong Kong. And thank you for joining us. All right. So let's get started. My name is Ethan Smith.
Hi. Sorry. Sorry.
That was the Hong Kong part. Just kidding. Meanwhile, you got a special shout out. Hello from the Ukraine. I don't think we've had Ukraine before.
Hi, Tatiana.
I think that's new. Hi, Tatiana. Oh, do we know? Lisa knows whatever.
No, I don't know Tatiana.
Okay. All right. She's so friendly.
Hi, Jeff.
Jeff somebody. I can't pronounce the last name. Hi, Lisa. Manal says. Okay. So welcome. Hello from school.
Oh, wow. Woohoo!
South Carolina. So my name is Ethan. I'm the National Ambassador for the International OCD Foundation, which simply means I have OCD and I like to talk about it, which is why we're here. Tonight, we are specifically here to support kids, teens, and families. I love this support group in this town hall so much because we know that there is a lot of change and a lot of disruption routine going around for mothers and fathers and sisters and brothers and children and school, and there's just so much to deal with and so much new responsibility for so many different people and so many different ways to handle it. So I'm super excited. We have all returning guests from last week. We have the incomparable Denise Egan Stack, Dr. Aureen Wagner, and Dr. Lisa Coyne, who are all three amazing experts in their field, and they're also all three amazing mothers, so we get both perspectives from them. So please, we're going to talk for 25-ish minutes on hopefully subjects that you will find helpful in your own lives, and then we're going to open it up to questions. So have your questions ready. Feel free to put them in the live comments, and we will definitely get to a Q&A in the next half hour or so. Just a quick note, this is a kids, teens, and families support group. It is kid-friendly 100% across the board. If you are an adult, if you have a question about your OCD, we're happy to answer it, but please keep it kid-rated. So no extra detail if you're dealing with sexual, violent, intrusive thoughts or things like that. We want to be mindful of the audience for tonight. Just some quick talking points to throw out to you. So we will talk on any and all subjects. We want to hear from you, get your thoughts and input as well, because you're in the trenches along with all of us. So we definitely want to hear from you, but we're also curious about how everyone is doing with the transition to virtual education. So is it easier? Is it harder? If so, in what ways is it easier and harder? And do you have tips for your fellow parents or students? I know we like to advocate a lot for ourselves in these comment threads. So if something is working for you, feel free to share it with us. But we look forward to talking a little bit about virtual learning and managing anxiety in a virtual classroom, as well as some other subjects as well. So that's enough from me. Let's get to the people at hand that we really want to hear from. So let me start with, I have to scroll down. Okay, let me start with to my left. It's reversed for camera. To my left, Denise Egan Stack. She is a home and community-based CBT therapist who's been treating children, adolescents, and adults with OCD and anxiety for over 20 years. So as I said last week, since she's been 12, she has been involved. The joke worked before, so I thought no, it's not good. Okay, I'll drop it. She has been involved with the International OCD Foundation since 1998 and currently serves on the IOCDF Board of Directors and Scientific and Clinical Advisory Board. She's co-writing the IOCDF website, Anxiety in the Classroom. So we have the source with us tonight and helps plan the pediatric programming at the annual conference. In addition, she has trained professionals nationally and internationally on evidence-based treatment for OCD. To just below me, but always at the top, is Dr. Lisa Coyne. She is the founder and senior clinical consultant of the McLean OCD Institute for Children and Adolescents at McLean Hospital. She's also an assistant professor at Harvard Medical School. She's the founder and director of the New England Center for OCD and Anxiety and is on the faculty of the Behavior Therapy Training Institute, otherwise known as the BTTI of the International OCD Foundation. She's also a licensed psychologist and peer-reviewed ACT, which is Acceptance Commitment Therapy Trainer. We'll talk more on ACT in a little bit. She has authored multiple articles and chapters on ACT with children and adolescents and is co-author of the books Acceptance Commitment Therapy, the Clinician's Guide for Supporting Parents, and The Joy of Parenting. Her new book, The ACT Guide to Teen Anxiety, and I did this last, and OCD, and The Stuff That's Loud, A Teen Guide to Unspiraling When OCD Gets Noisy, are expected in 2020. So Lisa is very busy right now, it sounds like, with lots of good stuff coming our way. And last but certainly not least, we have Dr. Aureen Wagner. She's an adjunct associate professor of psychiatry at the University of North Carolina, Chapel Hill, a director of the Anxiety Wellness Center in Cary, North Carolina, and member of the Scientific and Clinical Advisory Board of the IOCDF. Dr. Wagner specializes in CBT for childhood anxiety and OCD and is the author of Worried No More, Hope and Help for Anxious Children, Up and Down the Worry Hill, a children's book about obsessive-compulsive disorder and its treatment, What to Do When Your Child Has Obsessive-Compulsive Disorder, Strategies and Solutions, and Treatment of OCD in Children and Adolescents, a professional's kit. So thank you to Denise, Dr. Wagner, and Dr. Coyne for being here. All very intelligent, very well-published women, and we're excited to have your expertise. So let me throw this out first of all. So we mentioned anxiety in the classroom and virtual learning. I understand that all three of you are mothers. So what have you observed in regards to the transition from in-person learning to virtual?
It's hard. It's incredibly difficult. I have three kids. One is a college student, sophomore. Another is a senior in high school. And then I have a 12-year-old son who is in 6th grade, has ADHD. And my college-age daughter is pretty much independent. I mean, she's sort of doing it on her own, as is my high schooler. But my 12-year-old son is particularly, it's been hard to do that for him because like I said, he has ADHD and anxiety. And so he really does require a lot more assistance from me to get things done. And quite frankly, I haven't really prioritized his school. I've really been prioritizing our physical health and our mental health. And we get to the stuff that we get to. And I had to be creative with the teachers about them and pretty supportive. But I can't parent and work and be a full-time teacher, and I've sort of given myself permission to not do it the way that I thought I would be able to do it. But quite frankly, it's been pretty hard.
Mm-hmm.
Lisa, what have you observed?
So my kids are a little bit older, but what I can tell you is that for my clients, those with younger children, it's really difficult because it depends on the situation, of course. So if I have families who are where parents are required to work from home, find spaces that are kid-free, and then on top of that, they're required to also manage younger kids. That's a huge challenge. For some families with kids with anxiety, it's actually like one thing that has been helpful is setting a daily structure. Because one of the things that's happening, I think, for all of us is we're in a really uncharted, unprecedented situation, and we're not used to having such unstructured time in such a difficult, uncertain context. So when families are setting up routines that are workable, that seems to help some of the kids. So I'm noticing sort of a mixed bag. For my guys are older. We did have a sort of interesting Zoom bombing of one of the college classes. Not okay. But other than that, we're doing okay with that.
Dr. Wagner, what are you observing so far, either in your own home or clinic?
Well, my kids are in college, so I'm fortunate in that regard because they were already out of the house and managing their own learning. And, college kids these days do virtually all their learning through the computer anyway. They're submitting homework assignments and listening to lectures. So that's all. The virtual learning part is easy for them, and they're managing their own time pretty well. But again, I work with a lot of younger kids and families, so I have the elementary schoolers and preschoolers that I think parents are really struggling with. Is just, they can't sit still for that long. And how do you keep them active and busy and out of each other's hair and fighting and, while they're trying to do their own jobs? So I think I agree with what Lisa said about kind of developing a new structure, a new schedule. And it doesn't have to be rigid. And it can be, again, trial and error. We're all going to make mistakes because this is new terrain for us. We haven't done this before. But I recommend that people make a schedule that involves a balance of a little bit of schoolwork and a little bit of fun stuff, a little bit of sedentary stuff and a little bit of active stuff. Indoor stuff and outdoor stuff is allowed. Alone time and family time. So, and make that schedule every single day and make it exciting and creative if you can.
Yeah. One thing I think really important is having a family meeting, sort of everybody sitting down and talking about this is going to be different and here's how we're going to do it. And helping your kids can also help to set what that daily structure is. Then you might get better buy-in if they've been involved in helping to develop it. And again, the expectation is not that you're going to recreate the school day. The expectation is that you're going to try to get to some of the school stuff in addition to everything else that you're trying to do at home, work, parent. And I think that you can be creative. So you could say, like, here are the expectations before lunchtime. Here are the expectations before dinner. It doesn't have to be in 15-minute increments. Or you can leave a list of things that you want your student to get done, by the end of the day before they can have screen time. I definitely think, like we talked about last week, reinforcements like bribery, like if you do these things, then you can get this fun stuff. And I completely agree that you want to make sure that there's a balance between physical exercise, like movement, schoolwork, and fun. I think some of those are some of the tips that I would sort of impart when you're trying to make a schedule. But we've utilized the family meeting pretty well.
Mm-hmm. Okay. And I think one thing I'd add is screen time, right? I mean, all of us are on screens and it's so easy to get addicted to the screens. If my phone is next to me, I'm going to keep, wanting to look at it. So now that kids don't have structure, what do they default to? The easiest thing, which is screens, most stimulating, most exciting. But, screen time, we can turn that into a positive. So screen time is not all bad. I suggest limits, but I also say the time that they're using being on the screens, turn it into something educational or fun. And I'm not really a tech savvy person, but I'm hearing things like, oh, you can go on a virtual visit of Yellowstone National Park, or you can go visit the museums virtually. So turn it into something educational where they're still feeling that excitement of watching a screen, but it's also not just one type of thing like video games or, YouTube or something.
So
I would imagine it's kind of hard. Go ahead, Lisa.
So I was on another call today where I work with a coalition of behavioral science organizations that are kind of broad, like, Society for Behavioral Health, ACBS, etc. And there's a group called the Association for Positive Behavioral Support that have posted lovely resource that I'm going to email to you, Ethan, now, and maybe you guys can post it, but it's very helpful. Small interventions that can be useful for families. How do you set structures and things like that? So I'll go ahead and email that to you right now.
Great. And yes, any resources that that any of you will send us, we will put on the landing page. Again, if you're just joining us, this is a Teens, Family, Kids support group. We're here with Denise, Dr. Wagner, and Dr. Coyne. Please load in your questions in the live comment box. We will get to them in the next 15 to 20 minutes and do a Q&A. But right now, we're talking about virtual learning and the both the challenges and maybe the good things about it as well. So I'm gonna keep riffing. I'm gonna venture off the script a little bit and kind of go with what we're talking about. So Lisa, let me keep with you.
Okay.
You
terrify me when you say that, Ethan, but okay.
Okay. Should I say it nicer?
Go ahead.
Right, so, no, you intimidate me. No. So I think that is there a right way for a parent to handle this situation? Is there a one-size-fits-all solution, or is getting creative okay?
No, absolutely not.
I don't think any of us can answer that. No, and I think that if I got one message out tonight to families, it's be gentle with yourself.
Mm-hmm.
Okay, this is uncharted. We have been thrown something that we are going to have to adapt to and going to have to evolve to address. And there's no guideposts, there's no map, and there's a lot of uncertainty. And that can be frightening. It can also be a period of discovery where you take the time to really do your own trial and error learning, right? So I think one of the things that humans do when we're anxious about things and when there's uncertainties, we look for rules to follow. What are the rules? What's the structure, right? Because that makes us feel comfortable and contained. This is one where there's really an absence of those. And it's a time where you can really kind of think about, okay, what will work for me? And you may need to relax your ideas about the perfect education, the perfect way to handle it, being the perfect parent. That's a lot of added pressure and stress that you just don't need right now. I know I don't. So if I would say that, it's be gentle with yourself. And it's actually such a fabulous opportunity to learn how do we deal with uncertainty.
Mm-hmm.
I'm a big
proponent of trial and error, which means we try things out, they work, that's great. If not, we learn from them, right? Exactly. And as again, I think we'll all agree, this has turned all of our worlds topsy-turvy. Even those of us who thought we were very efficient and competent and got things done, everything's been disrupted. So it's a bit of a humbling experience for all of us. And I think it makes us, it could make us more grounded if we recognize that we're all fallible and we're all human and we all make mistakes. And, something I say to the families I work with is there's no such thing as a perfect parent. I thought I was one until I had my kids, and then it wasn't anymore, so.
Yep, same.
So, yes. So I think, yes, we all have to be very accepting and patient and compassionate and forgiving of ourselves.
Yeah, it's messy. It's going to be clumsy. I mean, I am an extremely organized, efficient person, and I definitely like rules. But again, I am practicing what I preach in this time period. I'm just giving myself permission to sort of feel it out as we go. I'm doing the best that I can, and it's going to be what it's going to be. But also, I have been talking to lots of teachers, lots of educators, and they really are also very understanding. I mean, they're going through the same thing too. And they're like, we're not going to be judging the students the way we would have before. Like, we understand that you guys need to prioritize mental health. It takes all sorts of shapes and forms, so instead of focusing on, my son's Egyptian pharaoh project, we're teaching him how to cook, and he's helping out with different chores and he's learning different things. Learning takes place in all sorts of ways. And I just think, there's no one size fits all. It's messy. Be kind to yourself and just kind of wade your way through it, and you'll learn the lessons and feed that information forward. Because, like we've been saying all along, this is super uncertain. We don't know when it's going to end, and we're just going to have to do the best we can here.
So every family's balance looks different depending on what their circumstances are.
Right. And, a lot of high schoolers and college students are kind of on a trajectory or a timeline to apply to college, to get jobs, all of that. And they feel like, oh, no, now what am I going to do? I have a client whose ACT exam was canceled the night before he took it. And he had worked so hard and felt like he was going to do well. And then he was so upset about it. And he said, no, I'm not going to get into college. And I said, what do you think? What do you think about everyone else? Did they get to take their ACT? Are they going to be taking it next month? No, everybody's in the same boat. And I think by that, we'll all be judged by the same yardstick in some ways. So again, keeping that perspective that if you've lost an opportunity to get an exam done or a job interview or an application, so has everyone else.
That's exactly right.
So has everyone else. So we're all in it together.
Absolutely. We're definitely all in it together. For those of you that are about to ask some questions, if you have questions about your kiddos, it's really helpful if you put their age, just so we know what we're talking about. There's a big difference in the way we answer a 5-year-old than we would a 15-year-old. A 15-year-old uses bigger words that I don't know. I can speak more to a 5-year-old. And Lisa is the smarter one here, so I'll let her handle all that. I like picking on Lisa. I feel like I'm on the top bunk and you're on the bottom bunk. You're having a sleepover.
That's hilarious.
No, it feels like Hollywood Squares.
It really does.
Let's do musical chairs. Let's do musical chairs.
Could we shift?
I just feel like we can all learn a lot from the neatness of all of your areas. Like Aureen's is the neatest, and then we go to Lisa's, which is sort of neat, and then Denise has a bunch of files back there. Well organized, granted.
Well, so, right out of range of the screen are all the piles.
I know exactly right.
So I don't want to get too off topic. I think, I want to reiterate, because it's an important topic or an important point, is that now is not the time to try to be perfect. What I'm hearing a lot is it's all about self-compassion. It's all about willing to make mistakes. It's all about trial and error and figuring it out. We're kind of thrown to the deep end of a situation here that we've never been in before. And so we can't necessarily know how to handle it. The needs of a stay-at-home mom that was already at stay-at-home and dealing with her child's education are completely different from, as Lisa, you were talking about, a mom who might be an essential worker that is working, can't work from home and has to come home to a household, and things like that. So any thoughts on the moms that moms or dads, I should say, that have to continue working during this time and at the same time be responsible for their children's education?
Yeah.
I think I would communicate. Oh, sorry. Was that to Lisa?
No, it's okay.
Yeah.
Go ahead.
I was gonna say, I think I would communicate with your child's teachers and tell them what your circumstance is and see if they can modify the assignments or at least prioritize the ones that feel really important. I think, reading, math, and writing probably are the things that we really want to be focusing on, but talk to your child's teachers and say, I'm an essential worker. This is what we're up against. Please help me figure out what things you really feel like are super important and what things we can let go of, or send me an alternative plan for my child.
Right. And I think it's important to mention that this is the first time teachers have ever had to do this at all.
Yes.
And so they're all floundering too. They don't know exactly what to do. And it's important, I think, to kind of, first of all, recognize that everybody's doing the best that they can. We're all working without a template here.
Yes.
And that, we're going to get through it one way or the other. And it's an event that hits everybody. So if everybody doesn't do it perfectly, great, we're all on the same boat. The other side. At the same time, I think one of the things that, I think a lot about is that the demands are so different developmentally for kids. So it's harder to manage. Like Aureen was talking about this, and I hope you say more about this. It's harder to manage kids who maybe are younger. They are less able to self-direct. Older kids, you might feel like you need to kind of make sure that they're doing their work, but they're actually more independent. And so it's going to be a mixed bag of things. So I think making a space for that too, and making what structures that you can in the uncertainty can be comforting. So this is the other thing I keep having. This is a conversation I've had with a bunch of clients today, a bunch of consultees. It's when there is great uncertainty, there's a lot of stuff beyond our control, but there's also stuff in your control. So really noticing like what is within my control and what can I do? So setting up, some sort of routine where you get up at around a certain window, and then maybe the morning is for school, and then maybe you have a break and you get to do something else. And like making routines can be comforting for kids of any age and parents also who need to work in breaks. And one of my favorites that I have heard and also have used as a parent is when parents need a break themselves, make a half an hour break and say, Mom or Dad, is busy for 15 minutes and no questions. Then you may watch your screen, or you may be on your iPad, or you may watch a show or something like that. And then we can, unless it's an emergency, define emergency. And then you can come back. So there's little things you can do to not just make a structure where there is none and make it loose, right? But also to give yourself breaks during the day when you need them.
Denise, Aureen, anything to follow up on?
I'll just comment a little bit more on the structure for younger kids. So thinking back to when my own kids were younger, and at one point in the summer, my husband and I were working on some big project, and they were much younger, so we needed to give them attention. So we tried to give them some schoolwork to do, the summer bridge exercises, which they've never forgiven us for. But anyways, my husband, who's not a psychologist, came up with this great idea that worked. He called it stations. And we put together like 8 different things that were different stations, and they could choose when they did the station. So they got that control. And then,
Awesome.
as long as they got it done by X time, by lunchtime, they had to do these stations. And for the afternoon, they had to do these stations. But they loved being able to pick which one they did in what order. Of course, my son said, can I play the video games first? Can that be my first station? And we actually said, okay, as long as you do the rest. And we set timers for 20 minutes. So they were 20-minute stations. And they learned to set the timers, and they loved that. It was kind of like a little game for them. But they loved picking, okay, which one am I going to do next? So, got to be, sometimes necessity is the mother of invention. I think we were in a place where we had to come up with something like that.
Yeah. I guess I just want to underscore something I said earlier, but Aureen just said, bring the kids in, help them, have them help you set up what the structure is. I think you'll get more buy-in. They may have really cool and creative ideas. I think that if you can tag team with another adult in the household, I think that's also good. So you can, take a break, get things done that you need, what you need to get done, extend your patience level a little bit. I agree that routine and structure is very good now. So in my household, it's like, get up, eat your breakfast, take a shower, brush your teeth, get dressed. No one's in pajamas all day long, except maybe the weekends or whatever. But I just think that, and then that's the beginning part of the day. And then there's a list of things that people need to get done, and then they can do the screen time or the whatever. But I think again, just have the kids help you figure it out. Even little kids will have some really cool ideas about how the day should go. And I think the little ones also, if you have it written out for them so that they can review, they can check things off, again, using a timer so they understand the passing of time. I think those are all like little tips and tricks that I think we've all used in our own homes and in our practices.
But there's something you said, I think, Denise, that's a really simple thing that's like so important. And it's do the hard thing first, and then you get to do the fun thing. And if there's like a principle that will help kids kind of adhere to a routine when it's hard, first this, then that, right? Put the less preferred thing first, and then the more preferred thing after. It's really simple, hard to do sometimes, but also very useful.
Yeah. Because what I find is that sometimes if the hard stuff goes to the end of the day, it's really hard to get kids to stop doing the things they really enjoy to do the harder things, right? I just think practically speaking, like people kind of fizzle out as the day wears on. So get the harder stuff first. But again, for us, it's incentivizing.
I always eat the vegetable first at dinner. That's like the same thing, right?
Yeah.
I always get rid of the vegetable so I get to the good thing.
Yeah, it's grandma's rule, right? Dinner first,
Exactly.
then dessert. Homework first, then play. That's a very key behavioral principle that we all use in our work. But again, if you have a child who likes to have a little bit of control or input or does better with having a say, I think giving them that option of saying, okay, if you choose to do your reward first, then, you have to make sure you finish your other stuff and do trial and error and see if they'll do it. And if they do it, that makes them feel proud. And if they're not able to regulate like that, then you, of course, have to put the work first. But I'm working with a middle schooler where one of the issues also families might notice is the kids with anxiety and OCD are so accustomed to being more needy of their parental attention. They're more dependent. And so now they're constantly coming to their parents. And this middle schooler I'm working with, she's very creative and crafty and can do a lot of stuff, but she's like, I don't know what to do. I'm bored. And she's constantly coming to her parents, right? So that's another issue that might come up, and you have to set limits for that. So I suggested that she sit down and make a list of all the things she could do in a day. And then whenever she said, I'm bored, the parents redirected her to go to that list and say, all right, go look at your list and do something, as opposed to parents trying to solve it for her.
Yeah.
So if you're just joining us, we're going to be answering all your questions very, very shortly. So please feel free to fill in the live comment section with any questions about you or your children or any difficulties that you're having. Again, mention your child's age so we can better answer the question and tailor the question to you. Before we get started, Dr. Wagner, I have a question for you, which is, it's easier, obviously, to explain things to older children. If you've got primary age children, maybe ages 3 to 10, and suddenly they're found they can't go outside and can't play with their friends, what's a good way to communicate sort of this new normal to them?
In the minimal terms, the least possible words as possible. I said a lot of words to say that. But little children, if they're 3 and 4 and 5, they really don't understand what's going on and don't need to know anything. So just sort of saying, what, some people are getting sick. And so we all have to be careful not to spread the germs, and we've got to wash our hands, and we can't go play with others. And chances are they've already encountered that kind of thing anyways when they're younger. If mommy's sick, don't go near mommy, or someone's coughing, cover your mouth. So they know all that. So that's all I do. And, for keeping them busy, they might say, well, all the other friends, they also have to stay away because, people are sick in the world, but we can find things to play with at home and finding ways to kind of keep busy. And I think parents and families are so resourceful and so creative. I'm sure you folks have heard of this one, but it came to my attention that some parents had put out a thing that, put some stuffed animals in your windows so that we can take our little kids for walks and make it like a treasure hunt for them to find all the stuffed animals in different people's windows. And I saw a lot of kids families on my street walking with little kids who were like, yeah, there's the teddy bear and there's the elephant. So, and that wasn't my idea. There was somebody on the internet. So again, necessity makes us very creative. So there's a lot of ideas, isn't it?
A lot of neighborhoods have Facebook pages where, they all talk amongst themselves. So if you have a neighborhood Facebook page, the parents can get on there and possibly create, a little games or programming. So when the kids go for a walk, there could be things in the window. That's such a cool idea.
Right. So when I went for a walk, I spotted all the teddy bears too. My kids were like, Mom,
I think that's a really awesome thing. And I think getting out is really important too when you can, for walks and things like that. And I've heard from several parents that they're worried about already, how do we transition back? And what happens if our kids feel like they've gotten used to being home and outside feels scary? So I think not only is that a great idea, but it also will help with generalization back home. And then I just wanted to say there's a resource I heard about today. So Axel Scheffler, who was the Gruffalo book illustrator, has just written and made free and available a book about coronavirus for kids. So if you like that book, I just sent Ethan and Jess at IOCDF the link, and maybe they can scroll it so you can kind of check it out.
That's awesome. Thank you. So this actually, any last thoughts, Denise, before I head to our first question?
No, I think everybody's covered it well.
Okay. So actually the question to Aureen was inspired by Jelly Bean at 7:06 p.m. Hey, Jelly, tell us your name if you want to. All I know is Jelly Bean is on YouTube, and her favorite Jelly Belly flavor is watermelon. I remember that. It is the true story. I asked her last stream she was on. So Jelly asked, how can I get my 15-year-old son to understand that things will be different for a while? He has OCD as well, but is just frustrated because he cannot see his friends in person, etc. Denise.
Yeah, I mean, I think that there's lots of parents that are asking the same exact question, you know, especially for teenagers who are sort of wired to want to be with their friends. And, you know, it's the spring and there's all sorts of fun things that are coming up, and people's birthdays and proms and, you know, all that kind of stuff. I think, again, it's sort of helping them understand that we're all in the same boat, and, you know, giving them the facts about how to flatten the curve and why it's so important to flatten the curve, but then also help them generate ideas for how they can stay in touch with their friends. There's lots of cool ways now. Again, like, you know, there's FaceTime and there's Zoom, there's drop-ins. And so I think it's also going to be just kind of repeating the message and trying to just come up with cool ways that you guys as a family can spend time together. Like, what are the ways that you guys can bond together? Puzzles or dance parties or cooking dinners together or whatever. So I guess I would just normalize the frustration. You know, it's a universal suffering at this point. We're all in this together. Provide them with some facts about why the physical distancing is so important. Help generate ideas for how they can stay in touch with their friends, and then try to make up the rest just within the family if possible.
Mm-hmm. I would say, again, just show understanding. That, you know, listen to your child, listen to your teen, let them gripe about it and validate those feelings and say, I feel the same way. I'm frustrated about so many things too. And I suggest actually maybe a daily check-in time. You can call it what you want, but sometimes it's for kids with OCD or anxiety, you can call it worry time. For those who ask a lot of questions, it's question time or just check-in time. So that once a day for about 10 minutes or, you know, twice a day, that's when they can kind of get it all off their chest and air all their grievances and gripe about things and be upset. But then at other times of the day, they've got to be refocused on sort of an active schedule. Because one thing is, if you allow them to complain all day, or ourselves, even if we allow ourselves to complain all day, we're miserable all day. Right? So we don't want to stifle it or suppress it. We want to acknowledge that our feelings are real and valid, but we also want to contain those feelings in some ways. So I think that optimum balance is to have these check-in times, and then the rest of the time we're going to focus on other things. And then during the check-in time, I recommend asking, what's your feeling temperature? And, you know, I have a feeling thermometer that you're welcome to download from my website that allows, you know, people to say how upset they are. And if they're sort of in that 8, 9, 10 range, that means they're very upset about something. And when your child or yourself, when you're in that range, you really just have to listen, and you just have to understand and let them feel those feelings, because they're not going to be able to problem solve at that time. We don't problem solve well when we're really upset, okay? But if their feeling temperature is 5 or below, that's when they'll do the best problem solving. So it's a wonderful tool during your check-in time to size up how should you respond as a parent. If your child is really upset, just listen, sit back, no need for solutions. If your child is, you know, calmer, then you can say, okay, well, what shall we do about that? What are some ways to handle that? So that helps you gauge that.
I have a follow-up question for either three of you based on what Aureen is asking, which is, how can parents tell the difference between just listening because it's anxiety and fear and enabling and reassuring because it's OCD, and determining that difference between possibly reassuring and enabling an OCD behavior or reassuring question and really just listening to anxiety?
So for me,
go ahead.
No, go ahead, Aureen, go ahead.
Fight it out. Come on.
My gauge for that is it reasonable to the context? That's the gauge. So once again, the feeling thermometer comes in very handy there. All of us have way more questions and anxiety than usual at this time. All of us are asking way more questions, right? So not every question is an OCD question. You have to size up when your child asks that question, does it seem reasonable? Okay. And generally, if the questions are reasonable, a hint or clue that they're reasonable is that your child is usually satisfied with 1 or 2 answers or discussions about it. But if it's OCD or anxiety, it's insatiable, right? You can answer the same thing 10 times, 15 times, 30 times, and they'll come back with that question. That's the difference, right? And so I tell parents, anytime your child asks a question, you should always give them a good, thorough response, as long as it's the first time they've asked and it's reasonable. But after that, if it keeps coming back, then you have to step back and treat it like an OCD question, which if you keep answering will just feed the OCD. And so then you have to set limits and direct it to question time. That's where question time comes in.
Yep. What other telltale signs? Your child needs you to say the answer in the right way. You know, like, say it the right way. Say it again. Say it again. So say it again. Say it the right way. Like, that's another way to tell that it could be OCD versus just a general concern that your child is having.
So for me, I do all of those things. And I also try to, like, there's a little simple formula that I think of, and it's first empathize and then support. And so I see how hard this is. That feels like you're really struggling. And I know you can handle that. If it's, you know, a reassurance seeking question, and I would use exactly the criteria that Dr. Wagner and Denise have described. But I think also a piece that's really important is like letting the kiddo know, you get how hard this is, you get how anxious this is making them, and just make a space for that in addition.
Thank you, Lisa. So we're getting lots of love on here from everybody agreeing with Dr. Wagner and Lisa, and Rebecca Youngblood Potter said, I'm a high school teacher, totally agree with Denise. She wrote that at 7:20, so whatever you said at 7:20, she agrees with that. But no, we appreciate all your feedback, and hello from St. Louis, and Lauren and Tamara. Tamara, Lisa wrote, McLean's OCDI has been my saving grace. I'm trying to be hypervigilant during this time of isolation. Which brings me to a good question. Is it time to go easy on your kids' OCD right now because stuff is stressful?
I think it's going to depend on the individual kiddo. I think it's really important to kind of, and this is a question that I think all three of us have been asked throughout the last several weeks. What do you do? So it's important to, and usually actually my clients are the ones who are like, I don't want to lose my gains. I've made gains. I don't want to lose them. And so they're kind of mindful of that already, depending on their age. I think that when kids are triggered, it's really important to know that, you know, to notice and understand that OCD can be mediated by stress. So like the higher your baseline stress, the more likely you might see or feel like you need to be doing more rituals. You need to kind of give in a little bit more and things like that. That's a normal fluctuation. So what I would do is I would treat it as another exposure. I would make some space for, we're all anxious, and you can also choose. And if you need to break down the work that you're doing into smaller chunks, or if you need to help your child break the work down into smaller chunks, or go back and do some easier exposures, that's totally fine. But what I would do is I wouldn't abandon it utterly. I would be flexible, and I would stick to that principle of, following whatever the CDC guidelines are about staying safe, and then leaning into exposures however you're willing to do.
Great. Thank you, Lisa. We have some really good questions here. Jennifer Butler Timko. Let's see, Jess. She asked a few questions. Actually, she's reiterating. So let's use the 7:25 p.m. She said, sorry, that was her daughter was typing. So she has an 11-year-old daughter, and her picking behaviors are exacerbated, and she'd like some suggestions. She specified that she currently picks the cat. So, Aureen, any thoughts?
Yeah, and I think it really depends on the overall presentation and what's going on there. But I might see if there's a way to, separate the cat from her. Basically, the treatment for repetitive picking behaviors falls in sort of two groups. One is to create obstacles to the behavior, and the other one is to create replacements. So make obstacles and replacements. And obstacles are put something away, or put a Band-Aid on your fingers, or trim your nails. They create deterrence to the picking behavior, right? So if that cat can be separated from her as much as possible, that's probably a way to break some of that rewarding behavior. The other one is to find replacements. So what would give her that stimulation or that relief or that gratification rather than picking the cat? So often it's some kind of sensory fidget toy, or go do something relaxing, do exercise, something to take away whatever's driving that behavior. But that being said, there's a complex assessment and treatment plan that is developed around that. So I'm not going to be able to address it specifically to you, Jennifer, but in a general way, those would be the ideas.
Yeah, definitely. Just one thing to add to that is it's important when you're using replacements, have them in the place that the picking is happening. So I love the idea of like removing the cat. That's the simplest thing in the situation. And also, if there are points of the day or places in the house or times or activities where picking is more likely, have those fidgets there right where they're needed all over the house. That's something that can be very helpful too.
Thank you, Lisa. Denise, anything else to add?
No, I mean, those are all the things that I was going to say.
Okay. So real quickly, this isn't a question, but I just think this is important for perspective. So Tatiana, our friend from the Ukraine, wrote, I've been having OCD since my childhood. There were no specialists when I was little. I couldn't understand what was wrong with me. It definitely affected my life a lot. Later, I found some information by myself and been able to understand my intrusive thoughts and compulsive behaviors better. I had experienced the war in my hometown before the coronavirus outbreak happened. So first of all, I'm sorry for everything that you've been through. I think it's awesome that you're here and you found us and contributing. I think it's a good reminder that we all have our battles to face, and we're all dealing with all kinds of things that we can imagine in addition to this COVID. And so thank you for being here. Thank you for sharing a little bit of your story with us. And if you want additional resources that we can hopefully help you and give you more information, feel free to email the IOCDF. You can email me at justethan@iocdf.org. And also the iocdf.org website has a ton of great resources on exposure response prevention and compulsive intrusive thoughts, as well as we'll list everyone's resources. But I just wanted to say thank you, Tatiana, for sharing that. I really appreciate that. Laura Hughes at 728. It's not a question, but I think it touches on a few things and tees off to the question we just answered. She asked, I'm an essential worker and my daughter 13 got bored and started pulling her hair again. So if kiddos have parents that are essential workers and starting engaging in destructive behavior again, what are some skills and tools that parents can implement to hopefully curtail some of that behavior? I'll open it up to anybody.
Well, it says that she started pulling her hair again. So I was wondering whether or not this was a behavior that was in remission or had been better managed. And if that's the case, then I would go back to what the original plan was or what the things were that helped her in the past. But again, it's sort of the same thing, obstacles and replacement, right? And so, an obstacle might be, again, Band-Aids on your fingers or wearing a hat or wearing a cap around. And then the replacement behaviors are similar to the ones that we talk about with the cat, right? But I do think that, again, sort of one thing that Lisa said earlier is that a lot of these symptoms wax and wane, and they can be exacerbated in times of stress. Or for people with picking behaviors or hair pulling behaviors like body focused repetitive behaviors, a lot of times it can also be when people are bored or they don't even know when they're doing it until it's too late. And so trying just to help them with self-awareness. That's why if you wear a hat and then you keep putting your hands up to your hair, you notice you feel the hat, not your hair, like, oh, I'm doing it again. So just trying to help your daughter understand that just because it's a lapse doesn't mean that it's forever, that there probably are things that she's done in the past to manage this behavior that she should reinstitute, and help her generate ideas for obstacles, help her generate ideas for replacement behaviors. But one thing she really wants to do is just recognize when she's doing it. What can she do to help herself understand, like, oh, right now I'm doing it, or oh, right now I'm walking into a vulnerable situation. I'm going to watch TV by myself. And that's always when I end up pulling my hair or touching my hair. I think that'll be a really good thing to get her on the right track again.
Agreed.
And Aureen, I think
awareness.
And Aureen, I think we can pick back up on some of the things you talked about with the younger kids, which is perhaps creating a more, routine and things throughout the day when she's not home to give her goals and things to do until Laura returns home.
Right, because Laura, when you say she got bored, it sort of says to me that loss of structure not being in school. And if you're an essential worker and therefore you have to be out of the home a lot, then perhaps, there's less supervision. I don't know who else is in the family, but I think sometimes it's a combination of that loss of structure. Suddenly the routine falls apart, and stress. So your situation might present both kind of elements for her, which will then make her revert to her older behaviors. So another thing I think about is like what I said with the middle schooler I worked with. I asked her to make a list of all the things she can do, right? Make a list, and then she makes a schedule and plops them into the schedule. What is she going to do in every half-hour block? And maybe you can have that check-in time with her every day, depending on your shifts and work hours. If you can spend 10 or 15 minutes of like alone cuddle time, TLC time with her, and she's probably missing you if she's home alone or she's home without school and you're not there because you're working. She's probably missing you too. So give her, fill up that gas tank a little bit for her, and then in that context, help her make a list of things to keep busy.
Yeah. And then I'm just one thing, Laura, I want to say to you is that I can just appreciate how hard that must be. Feeling like something's happening, you're not there, you can't help. That's really stressful and difficult for parents. And I think a lot of us are in that situation. So just be kind to yourself in those moments and know that you can set up all of these things. These are all great pieces of advice. And it likely won't be perfect, and that's going to be okay. So just to notice that it's hard, and be kind to yourself as you work your way through that.
Thank you, Lisa. So this is not COVID specific, but I love this question. I get it all the time, and I'd love to hear all of your answers to it. So I'm going to read the whole thing. I gave Jessica a shortened version of the question, but Pammy, hi Pammy, I hope you're well. Good to see you back here. At 7:28 p.m. asks, how do you suggest getting teens on board with therapy for OCD? Such a great question. Here's the rest of it. It's difficult to convince my 19-year-old that ERP is needed to set himself up for success in his life. His OCD is managed through meds right now, so I think he forgets how much episodes of his OCD can derail his life. He almost couldn't return to college because of it. Any resources that may appeal to a 19-year-old to give him some perspective? Let's go around the block because I have a feeling there's a lot of conversation around this, but it's an important question. So Denise, let's start with you.
Yep, this is an important question and is one that I'm asked a lot. One thing that I want you to think about is, are there ways in which you guys inadvertently may be making it easy for him to live with his OCD? So are there ways that you guys are accommodating him? And accommodations, like, we don't want OCD accommodations, we do want school accommodations, but do you do things for him? Do you make his life easier because maybe he doesn't want to get his own meals, so you get them for him, or maybe he doesn't have to do chores in the house because it's too hard for him? Because when you do that, you do end up taking away some of the pain of living with OCD. You sort of make it easier, accommodating. The other thing that I try to do when I'm actually working with a family with a teenager who doesn't really want to do the work is say, like, well, we're going to start making decisions about limiting the ways that we accommodate your OCD. And if you'd like to be a part of that conversation, that would be wonderful. Like, let's have that conversation together. But if you really aren't, then we're going to start to be making these decisions for ourselves, because OCD does tend to hijack a family. And I bet you there are ways that you're accommodating, probably just because you want to make your kid's life easier, but you can start to pull back, and then they're going to start to feel some of the pain or the consequence of living with untreated OCD. I think those are two good places to start. And then I'll let my colleagues answer the rest, because there's lots of things to say, but I don't want to take over the whole time.
Go ahead, Aureen.
So Pammy, yes, we get this question a lot, and it's very hard. I'm sure you're in a difficult place. One thing I would suggest is, if you aren't already doing this, is that you can seek out a therapist to talk as parents or as a parent, even without your teen, even if he's not on board. And the therapist, assuming you get a good therapist, so make sure you're getting the right kind of therapist who does, exposure and response prevention therapy. The therapist can give you a lot of personalized guidance. Now, here we can give you general guidance, but we don't know your unique situation in your family. So the therapist can give you specific guidance along the lines Denise was talking about helping you figure out how much are you accommodating or helping, and then teaching you how to gradually wean off that accommodation. Okay. The other thing I found is with reluctant teens or reluctant anybody is that if they've had the OCD for a while, they've kind of been derailed from their normal life trajectory. So they've lost out on friendships and socializing and doing things and hobbies and stuff. So guess what? At some point, they don't see the benefit of letting go of their OCD. They don't have anything to look forward to. What are they going to go to? I find that a lot with young adults. They've missed out on so many years that then it's almost frightening for them to recover from their OCD and then face the world that they missed out on. They don't have friends. They don't have they didn't finish the education they were capable of. They don't have the job they have the potential for. And so that's scary. And they want to retreat back into that world. So if, as a therapist, what I would suggest is to go back and find out what are the things your child likes or used to like in the past, and try to engage him in relearning and engaging those kinds of activities so that he at least has some shift in focus from the OCD, and then something to look forward to that will make him motivated to get into treatment. So there's just one additional point.
I agree complete with everything that Denise and Aureen just said. And, from an ACT perspective, and that's the acceptance and commitment therapy that Ethan mentioned earlier, we would use a very similar kind of approach. I would encourage you to talk to a therapist as well. And one of the approaches that's really useful for parents, even if your child is not interested, even if it's an adult child, is Eli Levowitz's SPACE program, which is specifically for parents. It's a wonderful protocol, and they have parent support groups. Maybe, Ethan, you guys can find the website and stick it up there. But that's a really beautiful approach. So if you can find a provider that does that, that's very helpful. From an ACT perspective, one of the things that we do when folks are unmotivated, whether it's a child, teen, or an adult with treatment, is to have them think about, what are the costs of your struggle with OCD? What has it taken from your life? It's taken up so much bandwidth for so long. What are the costs? And then we balance that with, if it were possible to build yourself a life, even in the absence, even if you've fallen off the developmental trajectory, which so many kids have done, right? Mm-hmm. If it were possible, would you want something different? And if so, what would that look like? And what if addressing this, even, at a pace that feels workable for you, would that be something you're willing to do? And so ACT emphasizes the idea of, a lot of times when I'm working with teens, one of the things that pushes them away is feeling like they have to do treatment. Someone's making them do treatment. And no one wants that, of course, right? But really shaping sort of one's willingness to do it and choice in doing it by really having them notice what are the costs and what are the things that are really meaningful to you in your life that maybe you've lost or that you would like to build. And creating that possibility. Those are two things that we would kind of highlight to see if we could get some motivation.
Yeah. The other thing I also like to help people understand is that generally when someone has OCD, they might be living an avoidant lifestyle, right? And so they might be avoiding all sorts of things that are hard, like talking to a teacher about a grade that they want to get fixed, or having an assertive, telling you what's wrong, or having an assertive conversation with a friend. And so one thing I try to do is to say, let's just start pushing back on the avoidance in other ways, loading, putting your dishes in the dishwasher, or brushing your teeth twice a day, or, something like that. There's all sorts of things that people can do to sort of push back on the avoidance. And that might help get a little bit of momentum going, where people can, see that they can handle hard things. They can do hard things. It's not as hard as they thought it was. It doesn't last as long as they thought it would. And it actually feels kind of good to push back on those things. That might just be a nice way to kind of get going without having to target OCD specifically.
Mm-hmm. Yeah, and I'll tap into my own lived experience here for a second. I think something that was very game-changing for me in my own experience in dealing with OCD, and it is my hope in always telling my story that people don't have to reach their bottom, because I was definitely at my bottom. But to Lisa's point about ACT, when I started to make very specific choices about what I was losing when I was choosing to compulse or choosing OCD over my values. So instead of looking at it like, in the beginning of treatment, it was like, do you want to fight your OCD? And if so, don't choose it. And I didn't really relate to fighting my OCD. It seemed really ambiguous and broad and nebulous. But suddenly when I made very personal choices and realized that if I was choosing to compulse, that I was also actively choosing not to get a job, meet a girl, have a relationship with my family. Like the list goes on of really important things. And every time I sort of came to that fork in the road of whether I could choose a compulsion or a value, instead of looking at a broad value, I replaced that with something very specific, like and very important to me. Like I want to meet someone, or I want to graduate college, or so. And every time I choose to wash my hands or whatever the compulsion is or avoid, I'm actively saying, no, I don't want that. And that really made a big difference in me in helping specify for me what I wasn't choosing when I was choosing OCD. The other thing I'll point out is that for 19-year-olds and teenagers and even young adults and frankly anyone with OCD, sometimes just connecting with somebody that has OCD and having a conversation doesn't have to be therapy. It doesn't have to be like you need to be talked to and increase. It can literally just be a connection. We have lots of resources of teenagers and adolescents and young adults that would love to talk to possibly your son, Pammy. I would also be willing to talk to your son, but really just connecting with somebody that also has OCD and that also has been through it and being able to relate really can open up a lot of possibilities. And lastly, the IOCDF has a large OCD community called Health Unlocked. We'll put a link to that in the comment thread. And you can also go on there and start interacting with other OCD sufferers that you may relate to with their subtypes. So that's always a good thing to do as well. This is not a question. I just wanted to point out Stacey Hirschman at 7:35 p.m. read Dr. Wagner. I like the point you made. You definitely set limits with your child at a young age because it definitely gets more difficult when they get into transitional ages. So Pammy also said, yes, we do a teddy bear hunt in our town. There's a map to find where they are. So much fun. Hey, Brian, it's good to hear from you. So let's see, Brian at 7:37 p.m. It's not a question per se, but I think it's worth addressing. As a person of ADD, with ADD and an essential worker, I can say during these times I've been having a hard time trying to keep days under control. Found making sure I have a specific schedule and keeping in touch with FaceTime and Zoom definitely helps. Jeff follows up with, are there other recommendations for those struggling with ADHD as well as OCD?
Structure and scheduling. And, if it's hard for you to do it for yourself, and if you have a family member who'll be willing to help, or if it's not a family member in your physical space, maybe a virtual friend or family member can help, that you trust, a friend or a family member. Maybe you can ask them to kind of do a joint schedule with you that you can hold each other accountable. How like when you want to exercise, if you want to keep up your exercise and you do it with someone else, you're more likely to do it. So it's that kind of idea maybe to kind of get someone else involved to keep you accountable and make you feel like, I've got to tell them that I got this done, so I'm more likely to do it.
Yep.
Yeah.
I also think exercise is really important. And if people use ADHD medicine to help them with structure and organization and getting things done to continue to use it as they think that would be helpful. And again, I think we keep saying structure, but how do you structure? So you might want to wake up and set a daily structure, or you might have a daily structure. I get up at this time, I eat, I brush my teeth, I take a shower, whatever. And then a list of things that you want to get done. And you can break it down if you want to. But I have lots of people that I work with ADHD and OCD, and we're making lots of lists, making sure that, again, bedtime's on track. They're not staying up later, and then sort of like reversing their sleep cycle. We're making sure that there's a rough schedule for their day. And then we plug in like school stuff or work responsibilities, making sure that they have a place to work where there's not lots of distractions. That they have time for social versus social happening throughout the day or social media happening throughout the day. We sort of have like specific discrete time periods for that. And again, like I said, using medication too as necessary if that is a part of your current treatment plan already.
Agree. Use compensatory strategies too. As someone who actually, I think I actually probably have ADHD. I have lots and lots of compensatory strategies that are useful, and I think that are all about structure. They're all about figuring out what's your baseline. How long can you actually work on stuff? Work in a break. Make sure that you have structured, scheduled breaks so that you chunk things in ways that are meaningful. Reminders are great. Use your iPhone. Set reminders on your phone. Change things up when you need to. So if something gets boring, right, which is of course a trigger for I need to get up and read something else, you can change things up a little bit. And then of course, make some rules for yourself about things like social media and like how accessible they are. So if your cell phone is a source of distraction, leave it in the other room while you're doing something, So there's a million different ways to deal with it. But I would say, I guess the first step is owning that it's hard for you to pay attention, or it's hard to kind of like not be impulsive. And given that, now what? Work from there.
Yeah. And if you're supporting someone who has ADHD and you're trying to figure out, how to help them, I would ask, how can I be helpful to you? Because a lot of times people who love someone with ADHD can end up being a big nag.
That's
and then
right.
that ends up just creating more discord. So if you're loving someone with ADHD and you want to know how to help, I would simply ask, what are the ways in which I can help you? And what do I do that is not helpful, that actually makes things worse? So sometimes when I'm working with kids with ADHD, I'll say to the parents, like, if they're doing homework, please don't come in and like ask them questions about what they want for dinner, or like drop off their laundry and tell them they need to put it away later or whatever. Like create just like this quiet, like workspace in work times where you're not kind of going in there, because if you don't have ADHD, you don't know how distracting that can be, or how task transition can be very difficult. And so have a conversation with the person you're trying to support with ADHD and ask them what you should do, and then maybe what you shouldn't do in order to help them stay on track.
Thank you, Denise. That was great. Go ahead, Aureen.
And I just add a comment. I really promote the idea of the planned breaks. And this is something I typically do with families whose kids don't want to do homework and are racing off and, distracted and full of inattention. And they're looking for breaks because they find the stuff boring or tedious or difficult. But instead, if there are planned breaks, and it's again akin to that idea of stations I talked about earlier, if you have short work blocks, like 20-minute stations and then a 10-minute break planned, it's a reward and they look forward to it. Okay, if I do my 20 minutes, if I finish my one worksheet of math, then I can play with the dog for 10 minutes on condition that when the 10 minutes is up, I come back and I do the next 20 minutes of work. But that's sort of like a self-reinforcing schedule. So if you're an adult with ADHD, you can easily plan like that 10-minute break to go check your phone or the news, as long as then you can break away and come back to it.
Yeah. One thing is, I think most teachers know this, but kids with ADHD process information oftentimes by moving around. And so you want to make sure that you're not like, sit still and sit at the dining room table and don't move. And, that's not going to work for them. And so there's like a bouncy ball that they can sit in while they do their work, or, there's like lots of great tricks that teachers have about how to keep kids with ADHD focused in their classroom, like different types of seating or work standing up. So you want to be flexible about that too.
So I just want to say thank you, Denise. I just want to say, Becca, at the bottom, I see your question and I'm going to get to it. So I don't want you to think that we're not going to, because it's an important question. But I actually want to follow up on Jennifer and her 11-year-old daughter who was picking the cat, because I think this is interesting information. And I'm actually going to turn this to Lisa. So actually, we can put this up. This is at 7:41 p.m. Jennifer continues and says, my daughter is 11 and was just discharged from intensive outpatient, is doing fairly well, except for one behavior that we haven't been able to help. She obsessively picks the cat in the scabs. So my question to you, Lisa, is, it's really important that parents, try not to become the OCD police and the BFRB police. They still remain parents, but at the same time, being supportive. We now have more information to know that her daughter probably has a fair foundation for living with discomfort and uncertainty, and tools that she can use to maybe try and resist a little bit more. What are ways in which Jennifer can encourage her daughter to use her skills and tools without becoming that police?
So I think it's important, and I think that if it were me and I had and I have dogs, I don't have cats, but I think one of the added stressors for Jennifer is going to be, oh my goodness, my animal's being harmed. How can I deal with that as well? So I think just noticing that that's an added layer of difficulty. What I would do is, you know, to the degree that she's just been released, she's doing really, really well. She's got a lot of skills. So I think reinforce that she's got really great skills and she's not great in this one area yet, right? And that this is something that she can certainly address. And I'm hoping that she really likes the cat. And so talking about, you know, how does this work with the cat? And I would do all the things that we talked about earlier. So first of all, I would, I think you need to start more directively if it's involving, you know, an animal that might get hurt. Maybe you do separate the cat from her, but then gradually reintroduce, gradually have more time with the cat and have all of those things. So have your daughter remember what are her triggers. Is the picking something that's purposeful and she's aware of it, or is she not aware of it? Do we need to do some awareness training with that? What's the, you know, there again, it's just like Dr. Wagner said, like there's a thorough assessment that can be done with this, but really noticing like what's the function that this picking serves? Is it in the context of boredom? Is it in the context of something else, some other kind of stress? So really knowing what the triggers are and the places and contexts in which the picking occurs. And then gradually increasing resistance while also making it harder to pick, right? So like wear Band-Aids, gloves, doing something else, having a replacement thing where you can pull, right? Or pick or peel if it scabs, things like that. And also make a space for this not to be, progress is never a straight line. It's very rare, right? It's always kind of like this. And so there's gonna be, you know, eddies and swirls here. So where she's going to be doing really well and then she might go back to it. So I think really focusing on, it can be hard and not be disheartened by that, but I think really focusing on the forward motion and really celebrating the little wins while managing the situation as best you can. So not controlling and not being the OCD police, but certainly being mindful about engineering contexts in which picking might be less likely until her daughter's willingness increases to do more of the work.
Aureen or Denise, anything to add?
I'm just betting that, I mean, she loves the cat and wants to spend time with the cat, and then not having the cat near her, having to be separated from the cat would probably end up being a very good motivator for her to try to use some of these other strategies to get the behavior under control.
Yeah.
Great. Thank you. And Pammy Lee, you said your son has intrusive thoughts and existential OCD. There are definitely people we can set him up with to talk to that are experiencing those are very common symptomatology. And Jennifer, who we just answered her question, to your Pam, if you look, Pammy, at 756, Jennifer wrote, my daughter just finished an intensive treatment program, as we just said, and before she started, I found her a mentor who had been through similar treatment, and they gave them their perspective as someone who had been through the program, and it helped get her there. So again, connection is really important. Let me scroll down to Becca's question. This is a question that we've been getting a lot lately, so I want to address it now. Becca Gurgley at 8:07 p.m. I probably massacred that last name. I apologize, Becca. We are really struggling with finding a local therapist who is trained in ERP for a 13-year-old. Can teletherapy be useful even if the patient and therapist never met in person? She also asked if we recommend a list of teletherapists. I see the IOCDF has already listed the resources, but can teletherapy be useful even if the patient and therapist have never met in person? I want to throw this out to Aureen as soon as we can see her. So we'll let the question up for 1 second. And then there you go. Work for it. Okay, we can remove the question.
Do you mind putting the question down? Then I can see myself even.
Yeah, there we are. Okay.
Yes. You know, ironically, this couldn't be a better time for teletherapy, because guess what? We're all pretty much doing teletherapy, right? So I don't know when you started looking for a therapist, Becca, but you know, before this COVID situation happened, they probably were few and far between and maybe not local, but now might be your time to really access somebody who's good, because a lot of people, I'm doing only teletherapy. I think all of us are really. You'd probably need to find someone in your own state or someone who's licensed in your state. But even if, I noticed the IOCDF comment that, you know, some people list themselves as teletherapy providers, but what I'm saying is a lot more people might now be teletherapy providers. So don't limit yourself just to that search term, but look for people in your state or in your area, and then call them and ask them if they're doing teletherapy. And the answer, can you do it with somebody who you've never met before? I just had a new patient who was 13 years old yesterday, and I met her and her mother for the first time over the screens. And I thought it went fine. I mean, it's never quite the same, of course, but it's certainly met the need, and it's better than nothing. And they feel like this is a good time. They have time at home now to work on this, so they wanted to do it, and it seemed to go just fine.
Yeah. And we got asked a question last week, and we all answered saying that teenagers are very comfortable connecting with people through screens, more so than we were, we are as adults. But I think that they just don't have the hangups like we do about some of this stuff. So I think that it absolutely can work. We all do it. I picked up a new person too. It's working out very well. But I just think your 13-year-old is going to be able to connect with her provider through screens, because I think they're connecting with their friends all the time through screens. They don't have a hang up about it.
I agree completely. And the data support that, teletherapy actually is very, very successful as it's comparable to in-person therapy. So I think that's really important. And I want to underscore Denise's point that the kids are better at this than we are. Mm-hmm. They really, really are. Yes. And I can't tell you all the cool things I've learned from my kids during the week, and kids from, I think, on the younger side, probably 7 or 8, all the way up to adults. So it's actually fun. And then another benefit, when you really think about it, is that it's like having a therapist come to your house, So if that's where the OCD is, and if that's where the rituals are happening, you're already doing your generalization work. There's no gap between you practice this stuff in my office and then you go home and practice it there. You're already practicing it at home. So it's actually really beneficial in a lot of ways.
Completely agree. Yeah.
I was doing a professional consultation with some colleagues this morning, and we started talking about this issue, and we realized that we as therapists are having a weirder time with doing teletherapy than the patients and the kids, because like you said, they're all used to screens, and they all do FaceTime with grandma and grandpa and Uncle Joe and, so and their friends. So they are way more comfortable with that medium.
I was just stuck on Uncle Joe. I was excited that we all have an Uncle Joe.
How about Aunt Lucille?
I don't have an Aunt Lucille. I do have a closet plant that I named Lucille. I don't know if that's the same thing, but it's a true story. So we are just wrapping up here on questions. I just want to point out something very important, which is I did get Becca's last name right. Thank you for the reassurance. I'm feeling really good about that. But I'm going to actually turn it over for last thoughts, but we do have a little bit of time. So I will go ahead and let everybody watching, if you do have 1 or 2 last questions, please feel free to put that in the comment thread. And as soon as we finish last thoughts, we'll jump to those real quick. So Denise, any final thoughts before we say goodnight?
I've been really loving these town halls. I mean, I don't know about you guys, but connecting to community has been really important to me in the last few weeks. And I just think that the IOCDF has just done a really nice job creating a place for all of us in the OCD community to get together and help each other, right? We're all going through the same thing. We're learning from each other. We're helping each other. And I know that that's just been a really important thing to help me manage my own feelings about what we're going through. So thank you, IOCDF, and thank you everybody who's come to the town halls and participated, because I just think they're really cool. And I hope that we can keep this up.
Thanks, Denise. Aureen.
Sure. Yes, I really enjoyed these town halls too. And it's a wonderful opportunity to connect with such a fantastic community. And for last thoughts, I would say, one of the things I've been sort of working on with families is thinking about how difficult times and crises can also be opportunities for growth and learning, and can bring out the best in us. So yes, we're all struggling. We acknowledge that. We accept that. We work with it. But, let's remember that we might end up doing much better in the end. We might learn so many things. We might find out who we are better. We might realize what's important in our lives, what we value the most. I think some families are finding that when they spend time together, they're enjoying that more than they expected, right? So there's both sides. There's the downside, but there could be a good side too. So I suggest focusing on not always just what's all wrong and what we can't do, but also what we can do. And the 4 C's of what we can do, you see my 4 fingers there, are to stay calm, to be consistent, so it's calm, consistency, containment, and caring. And calm means, yes, give ourselves time to feel our feelings and have our feelings. But remember that if we're always up here just really upset at 9 or 10 on the feeling thermometer, we're not going to be able to do any problem solving or move ahead. The second one is consistency, and we've all touched upon that, creating those new routines, those new structures, those new normals in whatever ways we can. The third one is containment, not just of the virus, but of our anxiety, right? And so we've got our instructions for disinfecting and distancing, and that's how we manage the virus. But how do we contain our anxiety, and how do we use it productively? So this is where the question time and the check-in times come in. So don't let it pervade your whole day and swallow you up, but contain it in certain areas where you can address it and not stifle it, but also not let it take over. And then finally, caring and compassion. And I think Lisa has brought up that point often enough in a wonderful way, that we need to care for ourselves and be compassionate and forgiving, and of others around us. Okay, we're going to be annoyed and irritated at everyone, making mistakes too. But we're all humans and we're all in this together. And let's kind of shift our focus again to what's important and how can we help others. And I know it's just wonderful to see the goodness in people's hearts and how people can come together in wonderful ways, and they're longing to help and longing to be a part of the solution. That's the inherent goodness in us as people. So find something where you can donate your time or resources. And I know that the distancing creates problems there, but remotely. Some people find strength in their spirituality. So, there's a lot of faith communities that have had to go fully online, and this is a time of religious celebrations in a lot of communities. So, seek that out. And then reach out to someone who you haven't talked to in a while, who you've been too busy to connect with, an old friend, an elderly person. Reach out and share something that will give them, something to look forward to. And then finally, gratitude. I think no matter how tough our situations are, we can always find something to be thankful about. And it'd be very important to take a few minutes each day to think about what we're thankful for.
What she said. Really nice. Yes, all of that. So one thing that I wanted to say is that, it's just such a crazy time, and it's so scary for all of us. But one of the things I'm really noticing, like in all of our communities, is how amazingly resilient and creative we are. I mean, we're discovering as we go different ways of connecting online, these teddy bear walks, these kind of people helping, offering to buy groceries for neighbors and things like that. All these fun, like I have musician friends and they're all jamming online together, playing games together. And so, in ACT, there's this piece that we call discovery. And it's all about, we can focus on the things that are the challenges and how do we adapt to this situation, or we can say, what's the new stuff we can learn from this? And if we're willing to kind of be uncomfortable with the uncertainty and kind of go, yeah, like here we are, and we're gonna do trial and error stuff, and we're gonna figure things out as we go in this messy way where we have to be gentle with ourselves. But what if some really cool stuff is available that we could learn? And so I think I want to leave you guys with that. Everything that my amazing colleagues have said, and feel free to, explore a little bit and discover, like, what if you could make this time with your family really meaningful? If there's a lesson in this that you could not get any other way, because this is a once in a 100-year event, what can we learn from this about ourselves and about the world, right, that we could not learn any other way? Give that some thought and see what you come up with.
And that's resiliency, baby. I mean, that's you build resiliency through getting through very hard and challenging times and stepping up into it. And I think that parents ask all the time, like, how can I help my child become more self-confident or more resilient? It's really stepping up in times of incredible challenge. And I think we're all doing that right now. So I think you're right. Like, there's a lot we're going to get back from this.
We are all braver than we think we are.
That's true. Growth comes from struggle. And I always say, if there was a way for me to grow as an individual by sipping daiquiris in Fiji, I would do it, but it tends to not work out that way. I have to usually go through some stuff in order to grow as a human being. And so that's just the way it is. But I'm a big fan of silver linings, and it's not negating any of the hardships and difficulties that people are going through. But I always, just from my own personal experiences with fighting OCD and my own journey, there's been a silver lining to literally every hardship or tragedy that I've been through. There really has. There's always a lesson. And so we may not be able to see it now, but it is out there, and it's always beautiful and gorgeous. And I always get excited when I see it because it is worth the lesson. I had a really ridiculous example of that, which I'm not going to say, but I want people to know that I'm sparing them from Ethan torture of rambling. So yes, I want to thank Denise and Aureen and Lisa for taking their time out of their busy schedules to join us and answer your questions. I also want to encourage all of you to go through the comment thread because, as usual, you all advocate for each other. And so there are lots of great input and suggestions from everybody. There are also tons of links to all the resources we talked about as we have the discussion throughout. We listed the links to Aureen's temperature thermometer and Lisa's references to the book she was talking about with the Gruffalo and all the other stuff. So I encourage you to go through the comment thread. And lastly, thank you for showing up. Because I think, we kind of all feel really vulnerable right now, but you have to give yourself a pat on the back. This is you being proactive. This is you addressing your needs during this time. And so, maybe you just watched, maybe you asked questions, but either way, you're showing up for yourself. So I would definitely give yourself a pat on the back for that. As usual, I always want to thank the IOCDF for providing a platform. I want to thank Jess behind the scenes for facilitating the questions and just helping everything happen. Just a quick announcement. This Saturday at 2 p.m. Eastern, we will be having our town hall as usual. It will be 90 minutes on self-compassion and coping skills. Lisa will be joining us along with two amazing other guests. So please tune in. Also, this is weekly, guys. So we are here for all of you and we are in this together. So we will be back here at 7 p.m. Eastern time next Wednesday to answer your questions and talk on topics. Also, if you want to email the IOCDF or you have questions or topics that you want us to address next week, please email us. Let us know what you'd like us to talk about, and we will definitely bring that up. So again, thank you so much. I hope you have a wonderful evening. Be kind to yourselves. Be gracious. Be patient. Be willing to be messy. I think we got some really great, valuable lessons today. So let's go into the week with an inspired heart and be willing to make some mistakes and follow our values. And we'll check in next week. Thanks so much. Have a good night.
Thank you, Ethan.
Thank you.